But in the health system, hospital employed world, you still have leadership pathways. There's sometimes teaching opportunities, particularly if there's an academic component, but you might move into a directorship role or chief medical officer role. You want to find out what these kind of leadership pathways are. And there's even clinical leadership pathways with a lot of larger systems. Also, physician-led versus physician-owned. Well, what does that mean? They're not the same thing. Physician-owned means it's your colleagues that have gone through what you've gone through as a physician and know what that's like specifically. That's the ownership. They're running this and making the decisions. Physician-led does not mean that. It means that there's a lot of responsibility there and maybe some good compensation to go along with it, but that you're still answering to administrators and executives. Not necessarily a bad thing. It's completely up to you. It's personality specific. When you see full-time and part-time, these are self-explanatory. FTE means full-time equivalent. It basically means full-time. But you want to find out if it's a 5-day work week, how much of that is clinical hours? A lot of times you have a 4.5-day work week where you work 4 days and then you come in for half a day to do your notes. 5 days, usually you come in, you work until noon on Friday, Monday through Friday, and then you have still the rest of the day to work on your notes. You want to find out, can I do this from home? You want to find out what you are required to be in the office for and what's the separation they have between your time seeing patients and the time that you have for clinical hours. You're going to have a good understanding of this, and you're going to know by the number of patient encounters and the hours you're working, what kind of realistic time frame you're going to have to do your notes. And fast-paced environment, usually a bad sign, unless you're one of those just go, 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 never want to stop, knock it out kind of people. It usually means they're short-staffed and overwhelmed. You always want to find out why. Tell me about it. Fast-paced. Walk me through what that means. Flesh that out for me. That's the kind of question I would ask. Has it always been this way?